We did this study looking at 354 randomly selected universities and colleges across the country to determine whether or not they required physical education to earn a baccalaureate degree. We found that less than 40% of America's college universities require their students to take any kind of physical education requirement. It's alarming that we see this major decrease in the amount of physical activity. It's actually the lowest recorded level that we know of since these types of studies have been done. They started in the 1920s and we're at the lowest rate ever, and it's about 25–30% lower than any previous study had ever shown. I think what it really means is that we have this physical inactivity epidemic and we're not doing anything about it. So we have these major social institutions, colleges, universities, K-12 school systems, and we do nothing about it. Yet we generate research that says physical activity is important. We fund research saying it's important. But when it comes to policy, we're not putting it into practice. It concerns me because kids come to college and they are not as healthy or physically active as they used to be, and yet we see this declining trend. If we can get kids to go onto a healthy trajectory, even in their college years, they leave the university and they're much more likely to engage in physical activity later in life. The American College of Sports Medicine has a Healthy Campus initiative right now. It's part of their Exercise is Medicine campaign. And the National Academy of Kinesiology has a focus on college and student health and well-being. Tying a study like this in with that is really an important way. So I'm very optimistic, given that national leadership and what we're doing here on a more local level, that that partnership will end up resulting in major changes for other institutions across the country. At Oregon State, we require our students to take 3 credits in what we call a fitness requirement to earn a baccalaureate degree. It's a 2-credit concepts class and a 1-credit activity class. So classes range from everything A to Z, archery through Zumba. We do everything for our students here. We do believe that we offer a model program, and we do believe that we're a model for other institutions to follow. Requiring physical education in university, first, it's a very minimal requirement and we get maximum benefit. So 3 credits out of 180 credits here at the university is all that we're asking for. So that minimum amount is actually related to long-term health and well-being. We know that, our research verifies that. When we offer it as a workout on your own idea, the healthiest students, they're the ones that use that workout on their own idea. So it's really trying to reach the students that are not healthy, and that's the majority of students right now. What we want to do is we want to emphasize that physical activity is a core subject. We see shrinking budgets. It's time to take some of that budget and reinvest it into the health and well-being of our students. And that will have a positive impact on the long-term health care of this country, which we're also concerned about. We actually see that college and university students that are engaged in physical activity, be it in an activity class or just sitting on an exercise ball, those kids are actually doing better in school than those that do not engage in physical activity classes. And this is overall cognitive performance. It's also with what's called executive functioning, the ability to make good decisions at the right time. So test performance goes up, physical health goes up. People are very concerned about what's going to help me get a job. If you're physically fit, it can help you get a job. Employers want to hire healthy, fit employees. They know that it relates to their long-term bottom line. If we have people that are going to be present at work, performing at optimal levels, this is the kind of employee that companies want. They use less healthcare resources. I want to see students be optimally performing, and when they're physically healthy, they will optimally perform in our classrooms. And that's what we want. We want alert students, we want bright, attentive students, we want them asking good questions, we want them using good thought processes cognitively. We want to see that high level performance. When they're physically active, we get a higher level performance.